Welcome, everyone. This is the info session on preparing for the MMI at McMaster. Obviously, on behalf of the bright student, the bright doctor, my name is Kevin, and I'm your presenter today. Today, we're focused on MMI preparation and the interview day. So we have webinars on a lot of the different parts of the application process. So if you ever want access to any of those, just give us an email, and we'll send you a link. And here's a little bit about me. So I'm a first-year medical student at the Mayo Clinic in Rochester, Minnesota, the United States. However, I applied to both Canadian and US schools, and I got into both. In fact, I got into McMaster's Michael D. DeGroote School of Medicine. I got in, well, actually, I interviewed there twice at McMaster. The first time I interviewed, I got rejected. Well, I got waitlisted, then rejected. The second time I interviewed, I got a straight acceptance on, what was it, May 10th, May 9th, that day. It was a straight acceptance. It was a great day, but I had already gotten into the Mayo Clinic, and I committed to the Mayo Clinic, which is the #1 hospital in the world. So that's why I chose the US over Canada personally. But anyways, if you have questions about international admissions to the US or anything else, just feel free to ask me at the end. We're going to have a Q&A at the end. And the real focus of this presentation is the difference between great answers and extraordinary answers, okay? So I'll tell you what that means. Now, let's get started. So what's the format? At McMaster is 10 stations. It's an MMI. We know this. In fact, I'm pretty sure McMaster invented the MMI, and it's where the Casper was born. So McMaster definitely gave a lot of great gifts to the world, right? Like the MMI and the Casper. What would the world do without the Casper, right? But essentially, you have a prompt, and you have some time to read it, and then you give your answer, and there's 10 stations total. But it's not really 10 stations because 2 of them are break stations. And when I was interviewed, the break stations are not like evenly spaced. They can be, but it's actually randomized. So you could even like start on a break station, which is the oddest thing ever. But yeah, feel free to ask me questions about that if you wish. So let's see some important topics. Okay, if you're preparing for your McMaster interviews, McMaster is a school that's dedicated to social justice, to fixing problems in Ontario, right? They have the School of Innovation. They have a lot of cool faculties that are aimed at this. So this is a list of topics that I would really know, right? Like the opioid epidemic, especially like in Toronto and Hamilton. There's a homelessness crisis in Hamilton, Ontario. If you've ever been to Hamilton, Ontario, things like Indigenous health, right? Because McMaster also serves the Indigenous populations. They have satellite campuses in Waterloo and Niagara. Things like racism and discrimination in health. I've gotten like the weirdest questions in my McMaster interviews. Weren't even like healthcare related, really. But this is a great list of topics to really study, okay? And don't worry about writing these down. These slides will be sent to you right after this presentation. But here's the thing. I applied 2 times to medical school, and I interviewed 2 times at McMaster, actually. The first time I got rejected, and the second time accepted. So what was the difference? The difference is the first time I applied, I would have a great understanding of things like this. And it wouldn't be like a textbook understanding where I'd be like, yeah, you know, like there are this many mental health cases, blah, blah, blah. They would be, I'd practice them a lot, and they'd naturally come in my answers. I'd naturally give points about Indigenous health, medical assisted dying. I'd understand these topics, and I was well-versed in giving my opinion on these topics. So why did I get rejected? Because the second time I applied and interviewed with McMaster, the difference was I started thinking outside the box when it came to my interview preparation. For example, like the first time I was like, okay, anything that's related to healthcare, I'm going to understand. Like Indigenous health, female reproductive health, and so on. But what about housing in Ontario? Right? Like we're young people. We got to buy houses one day. I know y'all see the prices of these houses. What about climate change? What about mid-level providers? So for example, in Ontario, now pharmacists can prescribe, I think it's 11 different medications that you'd used to have to go to your family doc for. That's really good because now family doctors don't need to like have this like 15-minute appointment just for this small thing that the pharmacist can get rid of, because we have a shortage of family physicians and there's a backlog of patients. Okay, but on the other end, some people are like, oh, what if we start giving too much power to pharmacists? They're going to take away the doctors' jobs. It's really big in the US, actually, this kind of talk. physician burnout, cancel culture. I can't tell you why, but so many interviews, because I've done 11 interviews total and 9 the second time I applied, my second cycle, across US, Canada, different provinces, different states. They've asked me about cancel culture so many times. Like, if someone is like accused of sexual assault, should they be let go of their job? Like, just accused. So you need to have opinions on things that are like, what does this have to do with medicine? But it's really like societal things that are affecting people, and anything that affects people is really a consideration of public health, which is related to medicine. The wealth gap. I had an interview where I was just shown a chart. It wasn't on Kira, it was like on Zoom, and I was shown a chart of like the world and the distributions of wealth in the world, and the only question was, what do you think of this? And I was like, man, like, this is not what I prepared for. I've been preparing for like organ donation, and now they're asking me about like the wealth gap, immigrant refugee health, AI in healthcare. You can expect to be asked questions on things that are changing the face of medicine as we know it, genetic editing, right? And then there's the stuff like the aging population. You might have funky questions. Is war good or bad? You should be ready for anything and everything. And this is the difference between the second time I interviewed with McMaster. I was really ready for anything and everything, and I'll tell you why. Okay? I'll tell you why. It's going to be towards the end. Like, how I prepared that kind of went against the grain of what everybody else was doing. But now, the way I think we learn best is through practice. Okay? So we're going to practice a question together. Imagine you're a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? All right, everybody read this? We can go to the next page. So now I'm going to give a great answer. I'm going to give an answer. Okay, let's see what this answer says. I would conduct a comprehensive assessment of the patient's pain. Cool. You're going to understand like what kind of pain the patient has. Does it get worse at night? You know, is it aggravate? Is it adult pain? Whatever, right? Then you could say, I would have open conversations with the patient about their pain experience and treatment history. If opioids are necessary, I would proceed with caution, starting at the lowest dose to avoid dependence. I would revise the treatment plan with the patient periodically, which means I would regularly review it and adjust as needed. So this is an answer to this question, right? You have this patient, chronic pain, wants opioids. How do you do this balance? And this is the answer. Now, can someone tell me, is this a good answer? And I promise you, I will not go to the next slide until one person either unmutes or puts in the chat, yes or no, is this a good answer? Who's going to be brave? Who's going to be brave and tell me? It's a fine answer. Jordan says it's a fine answer. And sigh of relief, Yusai says it's okay. So here's the thing, like, I thought this was a pretty good answer. And it's probably the sort of answer I would have gave the first time I interviewed at Mac. But here's where the difference is made. Here's the difference between great answers and extraordinary answers. Imagine you also said, I could first explore a multidisciplinary approach to treating pain. For example, physiotherapy, lifestyle modifications, exercise, diet. I would educate the patient about the risks of opioid use and how we can minimize these risks to build a trusting doctor-patient relationship. Now imagine you go beyond. You even say you're going to make connections to the opioid crisis, right? There's an opioid crisis in every metropolitan area, every major metropolitan area in Canada, especially in like Toronto and Hamilton. Even in North Canada, like the Northern Territories, you could talk about sickle cell disease and racism with respect to opioids. So did you know that a lot of times Black patients will come into the OR, the ER, the emergency room, and they'll be in pain, and then the doctor will be like, man, this lady just wants some opioids, right? But really, sickle cell disease is something that is more prevalent in Black populations. It's underdiagnosed, and it causes immense pain. So they would just be, disregarding this person's complaint and being like, oh, they just want opioids. You could talk about racism in that regard. You could discuss specific medical cases relevant to Ontario or Canada. You could talk about the science of opioid addiction. I took a course on, cell biology, and they briefly talked about it. You could briefly, obviously, wouldn't belabor the point, talk about the science of opioid addiction. They work on this receptor. You can mention your knowledge of naloxone training. Maybe you've done street medicine where you've been on the streets and you've seen homeless people and you've had to administer naloxone or so on, or taught about naloxone training. These are the connections. These are the cool ideas that really take immense studying, understanding, and practice with giving your opinion to get to this level, okay? And this is a level you want to be at in your interviews, because this level is great, but it's anybody's guess if you're getting in with this answer. Because you know why? Because everybody here is extremely deserving. And by the way, all the questions we're going to do today come from our website, which is thebrightdoctor.com, brightstudent.org, same thing. And this specifically is from the opioid crisis mini question bank. And the same answer we showed you is on our website, along with ideas to go beyond, like, referring to a pain management specialist or multidisciplinary pain clinic, talking about drug monitoring programs in Ontario, because Ontario has opioid stewardship programs. They track the use of opioids. But here's the thing. Why do you need to give that extraordinary answer? And this is because every year, like 600 people are interviewed, and what's the class size? 200, maybe 100 waitlist positions will come out of that. Everyone here, how hard you've worked. You know how hard everybody here has worked, and that everyone here is like phenomenal CARS score, phenomenal GPA, and what's the last one? The Casper. So y'all have worked your butts off, but everybody's smart. Everyone is saying the same stuff. They're really, all these things. So you have to find ways to stand out. And this is what I firmly believe, okay? So the first time I applied, I'd be one of these gray dudes. So imagine you have to like push this, right? One guy or gal, is doing this. So everyone's like looking there. They probably think this guy looks dumb, right? Because they're just behind. But really, they're about to win. So who was I last year? Last year, I was the person that was like, all right, I got an interview on Mac. That's awesome. I'm going to read Doing Right. I'm going to listen to White Coat Black Art. I'm going to listen to the CMAJ podcast, which is all great. I mean, those are phenomenal resources. They really are. Doing Right, I never read, though. I never read that book. But you know what the issue is? The issue is everyone's doing the same thing. So if they ask you a question, how are you going to stand out among the other 20 applicants answering the same question that the interviewer just saw? How are you going to stand out if you're reading the same resources, doing the same thing as everybody else? And sorry, there's a question in the chat. Simran asks, let's say to learn about sickle cell example, what should we use? Podcasts or search up medical cases? Is there a good resource for this information? So I will show you some resources that I use to prepare. And then we also have, as part of the Bright Doctor, a lot of resources that do this research for you, but we'll get to that. But I'll show you especially podcasts and things that I read that had that kind of information in them, Simran, so you can be giving those extraordinary answers, okay? And, I really thought about it, and I distilled it down to these 5 ways that people can generally stand out in their interviews. It's either you're addressing more perspectives than others, whether it's just a different perspective or you're demonstrating your knowledge. You're offering more alternative solutions, creative solutions, or how to avoid an issue in the future. You're a better speaker than others. You're more personable. Your answer is more organized. There's less ums and ahs in what you're saying. And you look at the camera and you speak with confidence, with sheer confidence. Or maybe, number 4, you make connections, either to your personal life, to your future career. Maybe you're demonstrating specific domain knowledge. They ask a question about opioids. You're talking about opioids. You're talking about naloxone training. And lastly, explaining why. A lot of people think they're the smartest people in the world. Oh, I'm going to say, you should make an app. You should make a website. You should use AI. Well, why? Why is that a better strategy? People don't say why. They think if they say cool buzzwords, they're gonna get out. They're gonna win. Now, smart aleck. Who is smart aleck? Everyone knows a smart aleck. Smart aleck's that guy or gal in your class that's always talking to people in a condescending way. They always try to sound like they're better, or like they know what they're saying, but half the time what they're saying is like just random, wrong crap. Okay? The issue is smart alecks, believe it or not, and I've seen this, they get decently far in this system because they can look at a camera and speak with confidence. For example, if I told you right now that giraffes on average have a neck that's 12 feet tall, would you believe me? Because I think I delivered that in a pretty confident way, but I fully just made that up. So what I find actually as a tip is find a political commentator on YouTube. Some like political dude that, you probably shouldn't be listening to this guy or gal because, it's probably not good for your mental health to be listening to politics that much, but just listen to the way they talk. Because, politics is BS half the time anyways, right? So they have to be very good at talking and convincing just to explain things to you. So that's something I did actually. Find a way to talk, maybe like a smart aleck, but obviously don't be the smart aleck. Should you speak for the full time? There's 8 minutes. Do y'all think you should speak for the full time? There were crazy people who told me you should speak for the full time. 8 minutes. Oh, how are you gonna come up with 8 minutes of things to say? 8 minutes? Dude, if someone spoke to me for 8 minutes, I'd fall asleep. And it's the same thing here, because you want to allow time for follow-up answers. I've heard 4 minutes. I personally just did 2.5 minutes, 3 minutes. I kind of play by ear, but I wouldn't go over 4 minutes. I wouldn't at all. And the thing is, in my personal experience, the interviewers want to help you, which means if you're saying some stuff and you kind of forget to mention a perspective or something, they'll be like, okay, well, good, but what about this? And they'll kind of prompt you with their follow-up questions to elaborate on points that you might have just forgotten about. So if you're going to talk for 8 minutes straight, not only are you going to bore the hell out of them, you're not going to get that opportunity to get those follow-up questions, which are going to help set you apart. Should you go in depth or broad? So some people ask, should my answer be super in depth, or should I mention like 20 things broadly? And my approach is generally you discuss 1 or 2 ideas very deeply, but you also acknowledge any other ideas or counterpoints either before you begin or towards the end. Like, okay, yeah, while this is my opinion, I also acknowledge that blah, blah, blah. And you can just briefly mention at the end just to show that you're not blinded to that other side of thinking. Okay? How are we doing? Everybody following along? We're going to do another practice question now. Okay? How does the Ontario health system address the needs of Indigenous populations, and what improvements can be made? So whether this is your question or not on your MMI, these topics, these themes could come up in many different ways, and testing kind of the same knowledge and ideas expected from you. Okay? So let's look at this answer. I'm not going to read the main idea, but let's look at the introduction that our applicant is saying, our interviewee. The Ontario health system has made efforts to address the unique healthcare needs of Indigenous populations, though there are still significant areas for improvement. So immediately with this first sentence, we actually tell the interviewer how we're going to organize our answer. We're going to talk about the efforts Ontario has made, and then the areas for improvement. If you don't follow that, they're going to be confused. They're going to be like, wait, so why did you mention areas for improvement if you never got to it? But this is a beautiful and very subtle way of organizing your answer. There's more explicit ways, which I'll get to. But let's continue. One way the system addresses these needs is through culturally sensitive care. This involves providing healthcare services that respect and incorporate Indigenous cultural practices, beliefs, and values. For example, some healthcare facilities in Ontario have integrated traditional healing practices alongside conventional medical treatments. And it goes on. So immediately, our applicant is talking about things that they know. Some healthcare facilities in Ontario have traditional healing practices. This tells us this applicant, this interviewee, has maybe volunteered in hospitals, has been part of these community initiatives, and they understand what Ontario already has to offer to Indigenous populations. in healthcare. Okay, so we're off to a great start. The Ontario government has also made efforts to improve access to healthcare for Indigenous communities. This includes funding for programs and services specifically designed for Indigenous populations, such as the Aboriginal Health Access Centers, which offer a range of health and wellness services. Again, they show that not only am I going to give this like general answer, but I actually know specific names, specific initiatives, specific things that are going on in Ontario that are addressing the issue at hand. However, now we're going to get to the second part, the areas for improvement, right? However, there are still notable gaps and challenges. One major issue is the accessibility of services, especially for those in remote or rural Indigenous communities. These areas often lack adequate healthcare facilities and professionals, leading to significant disparities in health outcomes. So this guy's not living in La La Land. They understand what's going on. Another area for improvement is the training and education of healthcare professionals. While some progress has been made, we can focus, I'm just skipping along, on cultural competence and the historical and social factors that impact the health of Indigenous peoples. So they gave a second idea of improvement. Now, a third idea. We need a greater involvement of Indigenous communities in the planning and delivery of healthcare services. So now we're not talking about what Ontario is doing. We're not talking about areas for improvement. We're talking about ideas for improvement. This could be achieved through more meaningful partnerships and collaboration with Indigenous leaders and organizations, ensuring that healthcare initiatives are community-driven and responsive to their specific needs. This is beautiful, because now we're saying, like, we got these problems, so why don't we get the actual Indigenous communities and their leaders so they can be part of the decision-making process, and not just, you know, some random person who thinks they're solving the issue. Let's get them in those decision rooms to see how we can best meet their needs, and then a conclusion is given. Okay, so let's analyze it again. Initially, they demonstrate amazing understanding of Ontario's policies and Ontario's services, right? This is already setting you apart instead of some generic answer that most people would give. Then they give ideas for what are the holes, what are the lacking areas, right? And they discuss, you know, we need more training on cultural competence. So they're showing their maturity. They're showing their maturity as an applicant, that they've been in these systems, they've been in the medical field, whether it's like volunteering or through these extracurriculars. They understand what exists, what can be improved. And then at the end, they hit us with innovative ideas. Why don't we get those Indigenous leaders in the decision-making rooms so we can best meet their needs? And then as part of our interface, you know, there's more ideas to go beyond. Maybe they could have mentioned healthcare infrastructure in remote Indigenous communities, right? Like telehealth, for example. What if we get telehealth? Maybe that can help. And so on, like ongoing research, more funding, healthcare policies, and so on. Also, if you look at avoid, like red flags to avoid, you know, don't overlook the historical context of Indigenous health disparities, including the impact of colonization and residential schools. So maybe this could have been a really cool thing to talk about in your answer, talking about residential schools and different things like forced sterilizations that have occurred in Indigenous populations that might lead to mistrust in the medical field, for example. So all these ideas are ways that you can stand out. Okay, so does everybody go with that? We're going to the last section of the presentation now. I promise you it'll be quick. So first impression, these are like my final kind of tips. First impressions matter a lot. In that thinking period where I had 2 minutes, I would kind of, near the end, I would practice the first sentence that I would say, and I would make sure I could say it like, boom, I could say it with utmost confidence, and I could say it very strongly. Because most people, they see the camera and they're like, oh, you know, and they give a weak answer. Also, I would always smile and introduce myself. Hi, my name is Kevin. Thank you for taking time out of your Monday afternoon to interview me. With whom do I have the pleasure of speaking with? That might have sounded corny to me the first time I applied, but it's actually a very mature way of introducing yourself and getting their name. And then you can mention their name. And at the end, I would say, thank you, Dr. Locke. Boom, 8 minutes later, I remember their name. Who the heck is saying thank you and remembering their name? No one, right? So a beautiful first impression, a beautiful final, you know, impression. And it's all these small ways that you start standing out and getting ahead of the pack. Now, personal questions. You could be asked personal questions. So these are usually questions that kind of gauge some part of CanMeds. I'm not going to bother you. You know what CanMeds are. I like this list. It's the American version, AMC version. So like communication, empathy, resilience, and so on. So you could be asked a question like, what is the biggest challenge that you've overcome? And I've seen this in a lot of interviews that I've done. Variations on this question. Name a time you overcame a challenge, you overcame a difficulty, or so on. And for example, this question is probably hitting like overcoming conflict, resilience, capacity for improvement, and so on. A lot of times follow-up questions might even be on this. Maybe the original question might not have anything to do with it, but a follow-up might, right? I can't promise you the questions you're going to get on interviews, but this is a good thing to prepare for. And the way you'd answer these is using the STAR method. STAR, situation, task, action, result. Now let's see an example. Last semester in the McMaster Biology Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. I was tasked with swiftly finding a replacement vendor without overshooting our budget. Boom, S&T out of the way. Here's the thing. You want to get S&T done with immediately because you don't get any points for having the coolest situation. You don't get any points for saying that you were in the Prime Minister's office and you were like curing cancer in the Prime Minister's office, okay? The biggest challenge you overcome. Obviously, this is a small challenge here, but you get your points for the action and result part, what you did, what your values are, what you took away from it, okay? Consequently, I quickly researched alternative suppliers, assessed their offerings against our needs, and strategically approached the most promising ones to renegotiate terms suitable for our budget. I used strategies like calling suppliers instead of email to ensure rapid communication. Ultimately, we secured the necessary materials under budget, and the workshop went on without a hitch, earning praise from attendees. Okay? Now, that is a good answer. It's probably the sort of answer I would have given the first time I interviewed with McMaster, what time I didn't get in. But there's a missing letter, and it's the T. So I think I invented this, but if I haven't, you can let me know. There's a missing letter, and it should be called the STAR method. The T stands for takeaway. And where possible, you should have a takeaway, like a personal story or relation to your future profession, okay? So let's look at what a takeaway would have been here. As I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills along with my problem solving, I will continue to ensure team needs are met for the benefit of my future patients. Beautiful. If I saw this, as an interviewer, this just shows utmost maturity. Not only did you give a very well-structured answer, you demonstrated your CanMed roles, you demonstrated thoughtful thinking as applied to the question, but now you're giving them more. You're giving them the idea that you've spent time thinking about your future profession. What is it like to be a physician? You're going to be in these teams, these rapidly changing situations, and you've thought about how these stories relate to your future profession. So here's the thing. You need to have stories ready for all these pillars, whether you're going to use the CanMeds items or this list that I've given you. And again, I'm sending you these slides, so don't bother writing this down. Always make sure you have stories or multiple stories for each of them that reflect your values, that perhaps connect to your future career, and that maybe even connect to the medical school. This is very cool. Okay, now before I talk about that, I want to tell you a story about my friend who's at Queen's University, actually. They said they would, on a Friday night, they'd grab a beer, and they'd have one stack of cue cards with the CanMeds roles, and another stack of cue cards with personal stories from their life. And they would just pick two cards at random and try to connect them to each other. And this is a brilliant way of being able to think on your feet, especially when you're asked a weird personal question you never thought of before. You spent like a bunch of evenings connecting stories to different values, and now you can think really quickly and never be surprised. Another thing, the medical school. This is another cool way that I used to stand out in my answers. I took this kind of from the American system because here in the US, where I'm doing medical school, a lot of people in the US, there's 150 schools and you apply to, 30, 40. The top applicants are getting dozens of interviews. and they're getting into like 10 schools, right? So the schools actually want to know, well, why do you want to go to this medical school? And you have to give them a convincing answer. Obviously in Canada, you're lucky to even get a single interview and you're lucky to even get a single acceptance. So they're not really trying to probe you on why do you want to come to this medical school that much. Although I've been asked, like, why do you like this medical school or something? But if you could, like, in your answer, you talk about opioid addiction, and then you're like, or like imagine there's a question about antibiotic resistance, and because that's a problem, right? Antibiotic resistance. And then you mentioned, well, I know McMaster in their MDCL building on I think it's the 3rd floor, they have one of the premier antibiotic resistance research laboratories in Canada, right? So if you can know these facts about the school, I mean, that is just like, no one is saying that. So if you spend like a day just browsing through McMaster's website, just seeing what they offer, heck, talking to students, maybe you go in there, take a little tour, that can help you out. I toured McMaster and I saw this. So if you can, include that too. All right. We're on time? Yeah, we're hell on time. I'm going to get into some final pro tips, okay? Organization. Organization is about letting your amazing answers get the recognition they deserve. And in the first sentence or two, I'd always give an outline of what I was going to say. So, for example, I'd say, hello, I will begin by addressing the pros and cons of implementing such a public health policy before giving my opinion and then relating it to an experience I've had in the area. Beautiful. This is so amazing because most people just start talking in a way that makes sense to them because they spent 2 minutes ruminating on this question, right? But they don't know like where you're going, where's your conversation going, right? This isn't like a casual talk between two friends. It's kind of like an essay in the form of words. So if you can tell them what to expect, they're going to really appreciate you because they've been hearing the same thing for like 20 times that day, right? Especially if you're an afternoon interviewee at McMaster. Then it's like, all right, I'm going to talk about pros and cons, then give my opinion. Okay, cool. And then I'm going to relate it to an experience I've had in the area. So you haven't even said the answer. You haven't even said your answer. But you've already started standing out because, now the person's like, all right, I've heard the same like stock answer 20 times, right? The same like politically correct whatever answer. But this person's going to give me a gift. They're going to give me this cool experience at the end. So they're going to be on the edge of their seats. What's the experience? No one else is doing this, right? Everyone's focusing on giving these like textbook answers to things and not relating it to their lives or all those cool ways I've told you of doing takeaways. And remember, first impression critical, went over that. Also consider a summary statement at the end. I don't think I have summary statements, but sometimes I would. They're not necessarily extremely important, but if it makes sense for you, have a conclusion if you want. Avoid extreme stances. So this is like, it goes without saying, but there's actually nuances to this. For example, imagine you're asked the question, should pharmaceutical companies be allowed to give gifts such as free samples of their latest medicinal compounds to physicians? And immediately I'd be like, no, pharma companies, no one likes pharma companies. The pharma companies should never give any physician a gift. Then it's a conflict of interest. The physician is going to be biased towards that pharma company, right? And so on and so forth. I'm not saying pharma companies are these like amazing people, but think of it like, okay, in Ontario, we don't have free drugs, we don't have free medications. You have to pay. We have Medicare, which means our healthcare at point of service is free, most of medical care, but we don't have pharmacare. Our drugs are not free. Most people either they use their employer insurance or their parents' employer insurance to pay for their medications like antibiotics. So what if a pharmaceutical company just gave a bunch of free samples of this life-saving drug to the doctor, and then the doctor has patients that can't afford that drug, right? Then that's pretty cool. Now those free samples are actually helping save lives for people who can't afford them. And what if the pharmaceutical company can't, they go bankrupt or they can't market? Well, they hire people have to feed their families, maybe they're part of the economy in the region, and drugs exist for a reason, right? They treat conditions. So even if someone seems super evil, always think, is there a mature way that I can understand their perspective? Which most people don't. Most people, they read, they're accustomed to going on Instagram, reading inflammatory things and becoming like super polarized towards one side or another. So always think, pharma company is bad. Well, maybe the pharma company, there is maybe something I can consider there to show my maturity in my answer. Study at night. When I was a teenager, I read this book, The 7 Habits of Highly Effective Teens. And it said, whatever you do before you sleep, in the hour before you sleep, gets replayed in your head up to 6 times more than anything else you did that day. Now, I don't know how true that number is, but I believe it because, imagine you watch a horror movie before you go to bed, you're going to have nightmares. But if you watch it in like the morning, you're going to have nightmares. Or like watching news and there's murders and there's bad things, you're going to have bad sleep. So what I would do, and this is how I would stand out, and this is to Simran's point, how do we learn about these cool things? I wouldn't listen to like CMAG or White Coat Black Art the second time I applied and I got accepted. I listened to cool things. I listened to like the Nature Biotechnology podcast, MIT Tech Review. I'd read that. Listen to podcasts while at the gym, like on economics, finance, technology, of course, healthcare as well. You can't skip healthcare. But I'd have this really rich and diverse perspective on a lot of topics, which can only come from learning about a lot of topics. So everyone's like, let me go read like health ethics articles. Well, cool. But you're not going to have the same cool answer as me to a question about AI and healthcare, because you've just probably been reading about the health ethics, view of that. But AI and healthcare, there's like a million things you could talk about there, but everyone's saying the same stuff. Yeah, we need to, watch the data we're inputting or whatever. So yeah, this is how I really stood out, and this is how I got those cool perspectives. Zoom out. So you're using Kira Talent, I think. If they keep it the same this year, it's Kira Talent. Sometimes it's like a big block, the question or the prompt, and it might run off your screen. So just zoom to 90% perhaps, and you'll be good. Share videos of your answers with colleagues. So this is how I practiced. I would film myself, and I would share it with my friends and who were also interviewing. And let me show you our website. This is what our website, The Bright Doctor, looks like. We have question banks. Let's go to the MMI question bank. And you can set up your interview just like McMaster, 2 minutes to read, 8 minutes to answer, but I'll give myself 3 minutes to answer because I don't want to be talking for 8 minutes. And then it comes, an 8-year-old patient comes in after a life-threatening injury and urgently needs a blood transfusion to live. However, the patient's parents strongly oppose it based on religious beliefs. What should you do? So this is like an ethics question. This is like the Jehovah's Witness question. And then you can film yourself and your answer. Ta-da-da. You can answer for 3 minutes. I'm going to skip ahead. And then you can save your video, and then you see the answers. And the idea is to go beyond, red flags to avoid. So I would save these videos and share them with my friends. And then, there's like 100 questions, antibiotic resistance, and so on and so forth. Lastly, practice, practice, practice. So there's a lot of topics, okay? And not only do you have to understand them, but not in the textbook sense where you understand like, 4% of blah, blah, blah. You need to be able to be comfortable giving your opinion on these topics. So again, these slides will be sent to you. And we have, Ontario Health Policy. We have a lot of mini question banks. So you can focus on things like the opioid crisis, alternative medicine, telehealth, US health policy. I spent a lot of time in my answers at McMaster. If there was like a health policy question, I'd mention maybe how the US was doing it or how England was doing it. Because I took a course actually on global health systems. And that really helped me give diverse opinions in my answer. Because I'm talking about like how Singapore's health system works, whereas everyone's just like, oh yeah, well, Ontario should do this and this and this. But I'm like, okay, we can actually learn from Germany, the Bismarck system in Germany, or the NHS in England. We can learn about them, right? We have mini banks on AI and health, social determinants of health, other provinces you can learn about to compare and contrast, genetic testing, CRISPR, vaccine ethics, and so on, okay? So this list is going to be sent to you, and we will be giving you a subscription credit to our monthly subscription on The Bright Doctor. These are going to come with the slides right after this presentation, and that is it. That's the presentation, as I promised. We're on time. Are there any questions?